Hello class, my name is Valerie Ellis and I am here to inform you of urinary tract infections, also known as UTIs. My primary focus will be on UTIs in children. My 6-year-old son was recently diagnosed with a urinary tract infection. My interest was immediately piqued. I wanted to know what caused it, how to treat it, and most importantly, how to prevent it from happening again. By the end of this presentation, you will know what a urinary tract infection is, the causes, symptoms, diagnosis, treatments, and preventative methods for UTIs. A urinary tract infection is an infection caused by microbes such as bacteria, overcoming the body's defenses in the urinary tract. The urinary tract is a system in the body used to remove waste and excess water. This system consists of the bladder, the kidneys, the ureters, and the urethra. It is important to know the symptoms of UTIs. Symptoms are the first indicators letting the body know that something is not right. The symptoms are a strong and frequent urge to urinate, pain and burning sensations with urination, urine that smells cloudy or unusual, lower abdomen and back pains, bedwetting, difficulty urinating, blood in urine, fever, and irritability. My son experienced several of these symptoms. He had the urge to urinate often, and it was very difficult for him to do so because of the pain and the burning sensations associated with doing so. The smell of his urine was very unusual. He experienced so much discomfort. I knew I had to take him to the doctor because at this point there was nothing I could do for him. That was when I was informed he had a urinary tract infection. A UTI is diagnosed with a urine culture. You might be thinking, what is a urine culture and how is it done? A urine culture is a test that detects the levels of bacteria and yeast in urine and how fast it grows. In order for this to be performed, a sample of urine will need to be collected. UTIs are treated with antibiotics for 7 to 10 days. The doctor may want to do a more extensive test, such as an ultrasound of the bladder and kidneys. In my son's case, his pediatrician decided to send him to a radiologist for an ultrasound. During the get well process, be sure to give your child the accurate dosage of prescribed antibiotics to cure the infection. Your child should be consuming plenty of fluids, water to be exact. Avoid giving your children caffeine, tea, and carbonated beverages because they tend to irritate the bladder. Now that you know what UTIs are, the symptoms, and how it is diagnosed, let's talk about what causes urinary tract infections. Some causes of UTIs are poor hygiene, ignoring the need to urinate or holding urine for long periods of time, not emptying the bladder completely during urination. In girls, wiping from back to front after urinating or bowel movements, using bubble baths, shampoos, or soaps and bath waters, constipation, and abnormalities of the kidneys or bladder. Now that you know the causes, the preventative methods are pretty simple. Teach our children to do the opposite of the causes. Teach them good hygiene. Encourage your children to avoid holding urine for long periods of time and to go to the bathroom as soon as they have the sensation to go. To empty his or her bladder completely after urination. Wipe from front to back after urination or bowel movements. Avoid using bubble baths, shampoos, soaps, and in bath water, and to drink plenty of water. Today I have informed you on what UTIs are, the causes, symptoms, diagnosis, treatments, and preventative methods. It is my high hopes that you understand the severity of UTIs, take heed to the preventative methods, and seek medical attention if your child experiences any of the aforementioned symptoms. For additional information, please visit www.helpline.com. This concludes my presentation. Until next time.